So with all the talk recently about health insurance and healthcare recently, there was what I thought was a really, really interesting article in Hospitals and Health Network's website, Hospitals and Health Networks. And the article was titled, How Healthcare Leaders Should Navigate Quality Reporting, written by Maggie Van Dyke. Really good article that focused on the issues facing doctors and hospitals when it comes to Medicare reporting requirements for something called value-based payment approaches to healthcare providers. And if you aren't familiar with value-based programs, we actually have talked about them here on the show. It's been a while. These are value-based programs are Centers for Medicare and Medicaid Services, CMS programs that reward healthcare providers with incentive payments for the quality of care they give people with Medicare. Now, as Van Dyke explains, value-based payment approaches, including Medicare's Quality Payment Program, or QPP, which is for physicians and other eligible clinicians, tie fees and bonuses to these doctors and clinicians to how well providers perform on various cost measures. Now, the assumption is that quality of care can be easily measured and reported. In reality, Van Dyke writes, these measurements are still kind of evolving. And while the idea of pay for performance in healthcare makes sense, it's kind of how a lot of other services work after all. You get paid for how well you do, or not paid at all if you do poorly. It only works if you are measuring the right thing. And we talk about this a lot. It doesn't matter whether you're in healthcare or anything. If you're collecting metrics or KPIs or whatever you want to call them, and you're not collecting the right ones, it doesn't do you a whole heck of a lot of good when it comes to improving what you're doing.
Right, exactly.
Okay, so now along with the burden of reporting and some technological issues with e-records, electronic health records, and electronic health reporting, her article points out a couple of problems with value-based payment programs in general. The first is that the metrics being reported are often related to process. Was a certain test done, for instance, as opposed to patient outcomes, right? And I suppose in manufacturing terms, this can be analogous to, I don't know, did we build it to spec?
Yeah.
You know, as opposed to, was it what the customer actually wanted or needed, right? Okay. So, you know, so I mean, I don't think any of us would argue that following a process, you know, or meeting spec is important, but more important is it what the customer or patient needs? So in the case of healthcare, are we measuring and acting on, are the doctors measuring and acting on, healthcare providers measuring and acting on what will make the patient healthy or make the community healthy? So in many ways, says Van Dyke, CMS's quality payment program is actually moving providers in that direction, moving them toward more meaningful quality measurement. For instance, QPP has two tracks. Providers in the merit-based incentive payment system track only have to report on 6 quality metrics now, and this is quite a few less. I mean, it used to be like even dozens, from what I've read and heard. So it's quite a, 6 is quite a few less. And also, they are required to choose at least one outcome measure, so patient outcome measure. On another track, providers that participate in Medicare's advanced alternative payment model are tracking both a number of outcome and population health focused measures. So in other words, slowly as they learn how to do this and understand what to collect and what really makes sense, they're moving away from simply process and looking at what are we actually accomplishing in terms of patient or community health. And actually on their website, Medicare has a great way of putting this. They're saying it's helping healthcare providers focus on care quality and the one thing that matters most, which is making patients healthier. So in other words, collecting the metrics that actually make sense. Now the second problem with these value-based approaches is interpreting metrics from one healthcare provider to another. So think of this as in our manufacturing realm, let's say, you have multiple audits. You have an audit from one vendor or one customer, and you have an audit from another customer, and they're supposedly maybe looking for the same thing. Well, in the healthcare, Van Dyke points out that different payers ask healthcare providers to report on what might seem to be the same thing, such as, let's say, tracking hemoglobin levels in patients with diabetes, but the details often vary. So think of your two different second-party audits, right? So for instance, one payer may define diabetes control as an A1C level below 9, while another defines it as being below 8, meaning one payer might think you're keeping your diabetes patient's hemoglobin levels under control, while the other say, well, no, you're not. And of course, in a value-based system, this is going to have an effect on your payments, right? So you know, what are you doing? One says, yeah, you're under control. One says you're not. One's going to give you your incentive bonus. The other one's going to not going to do it. So it's a big deal.
Yeah, it is.
So to address that issue, writes Van Dyke, one healthcare system has created a standardized set of quality metrics for its employed and affiliated physicians so that those doctors don't have to worry about different measurement requirements from Medicare and a different one from commercial insurers. So they've created one standard that everybody can agree on, and you know, that makes a lot of sense. So there's a lot more to this really well-written article. If you're interested in the problems and some of the solutions to value-based reimbursement, take a read. I mean, whether you're a healthcare provider or healthcare user, it's important to understand the shape that healthcare is taking, because it affects all of it. It affects what healthcare costs us as well. I mean, that's the whole idea, right?
Yeah, interesting article. You know, as you're going through that, I thought about two quotes from different people that we quote a lot here. Philip Crosby was the first one, I believe, who said that quality is conformance to requirements. And whose requirements? Customer's requirements, right? I mean, if you're going to build a spec, I mean, it's got to be built in what the customer wants. The other one was from our friend Davis Balistracci, who always says that you want to make sure you're not measuring the wrong things better, you know?
Right. We're really good at measuring this stuff.
At measuring the wrong things.
Unfortunately, has nothing to do with what we need to do.
With what we really need. So I mean, you know, people have thought about this for a while.
But by the way, the pay for the value-based payment thing in Medicare and it's still. It was very controversial when it came out. I think it's still somewhat, because it's still, I think within the healthcare field, still kind of rankles that I'm having to report on stuff. But I think they're dialing it in, so where even the doctors begin, okay, well, if you're measuring this, now we're talking something that makes sense.
Yeah, getting doctors on board is always the hard thing about that. Great, thanks, George.